How do doctors treat recurrent Ewing sarcoma? How do doctors treat recurrent Ewing sarcoma? This is a crucial question for patients and families facing this challenging diagnosis. Recurrent Ewing sarcoma is often treated using a combination of therapies tailored to the patient's specific situation. Factors such as the location and extent of the recurrence, previous treatments, and overall health play a significant role in determining the best approach. One of the primary treatment options is chemotherapy. In cases of recurrence, doctors often use combination chemotherapy again, sometimes with different drugs than those used initially. The goal of chemotherapy is to control cancer growth throughout the body, especially if the disease has spread beyond the original site. Surgery is another important treatment option. When it is feasible, surgical removal of recurrent tumors is performed, particularly for local recurrences. Radical surgery to remove isolated local tumors can improve survival outcomes. In some cases, surgery may follow radiation therapy, especially if there are residual tumors in the lungs. Radiation therapy can also be applied to local tumors or metastatic sites, such as the lungs. It is used both with the intent to cure and to relieving symptoms, improving the quality of life for patients. Radiation is particularly beneficial for isolated pulmonary metastases, helping to manage the disease effectively. In certain situations, an autologous stem cell transplant may be considered after high-dose chemotherapy. This approach helps restore bone marrow function and is sometimes used in cases of recurrent or progressive disease. The choice among these treatments depends on various factors. For instance, whether the recurrence is local or distant, the time elapsed since the initial remission, and the patient's previous therapies all influence treatment decisions. Patients who experience a relapse early, during, or soon after initial treatment generally have a poorer prognosis. In contrast, those with local recurrence often have better outcomes than those with distant or combined recurrences. Because recurrent Ewing sarcoma can be challenging to treat and the prognosis is generally poor, doctors often recommend clinical trials. These trials provide access to new therapies that are currently being investigated, offering hope for improved outcomes. In summary, the treatment of recurrent Ewing sarcoma involves a multidisciplinary approach that combines chemotherapy, surgery, radiation, and possibly stem cell transplant. The goal is to control the disease, alleviate symptoms, and extend survival. Individualized treatment planning by a specialized oncology team is essential for achieving the best possible results. Always consult healthcare professionals for personalized medical advice tailored to individual circumstances.